welcome everybody to our Quality Improvement webinar. We'll be covering PIP QI and continuous quality improvement today. My name is Sophie Bond and I'm a Quality Improvement Consultant based out of our Central Victorian office. And I also have our colleague Emma Ebery, who is also from our Central Victorian office, presenting today. Firstly, I'd just like to acknowledge the traditional owners of the land on which we work and live. We recognise, celebrate and respect Aboriginal and Torres Strait Islander people as First Australians. We acknowledge their unique cultural and spiritual relationships to the land and waters as we strive for healing, equality and safety in healthcare. We pay our respects to their elders past, present and emerging and extend that respect to all First Nations people.
Thank you, Sophie. Welcome everybody. From today's session, we hope that you gain a greater understanding into what is PIP QI, how does continuous quality improvement benefit your practice and patients, accreditation and quality improvement, PIP QI roles and responsibilities, how Murray PHN can support your practice with quality improvement. We will also provide you with a very quick quality improvement demonstration and discuss some resources with you. So what is PIP QI? The PIP QI, or Practice Incentive Payment, is a payment that general practices can register for. It was first launched in 2019 and is a payment that is there to encourage practices to participate in quality improvement activities. These activities are aimed at improving patient outcomes through the delivery of high quality care. There are guidelines that sit around the PIP QI, and these are available to you from the Department of Health website. Even if you choose not to participate in PIP QI, continuous quality improvement is still required to be undertaken and documented for accreditation purposes. We always like to support practices to align their PIP QI and accreditation activities so that they're killing two birds with one stone. When RACGP standards were released, the new 5th edition standards, as many of you are aware, they were broken into 3 modules: core, general practice and quality improvement. The quality improvement module is comprised of 3 standards within itself, under which there are criteria to be met. You would be demonstrating that you're meeting these indicators through the quality improvement work you do. The indicators in this edition, where appropriate, have been focused on outcomes for patients as opposed to prescribed processes or what the practice does. As an example of how accreditation and quality improvement can align, we can see here under criterion 1.1 of the quality improvement module that our practice has at least one team member who is the primary responsibility for leading our quality improvement systems and processes. This is information that would be documented within your PDSAs, and we always encourage you to work strongly as a team on quality improvement. This is giving you an understanding of how continuous quality improvement activities should be conducted, with someone leading a team and a group of people in the practice who are committed to the quality improvement. Our team can work with your clinic to implement these processes and to assist your clinic with understanding the importance of what each person brings to the table and how everyone has a role to play in PIP QI. This would also meet your PIP QI guidelines. Throughout the quality improvement module within the standards, there are many indicators that PIP QI activities can be based on. You can see some examples on the screen here. We can assist you with aligning these activities to meet both the criterion for accreditation as well as your obligations under the PIP QI. We want to help you work smarter and not harder. Over to you, Sophie.
On this slide here shows the PIP QI roles and responsibilities between the general practice and Murray PHN. So we can work with your team to develop a 12-month QI plan to help keep QI on track and integrate it into daily practice, aligning this across both PIP QI and accreditation. We also recommend a whole of practice approach, as everyone across your practice plays an important role in the running of the day-to-day business and patient health outcomes. We have developed some draft PDSAs and short videos to assist with QI activities, which are available on our website. Working with and understanding your practice data is a key component to meaningful quality improvement. Your practice data provides the evidence of where the practice strengths are and also shows where there is areas for opportunity. From there, you can, as a team, start to identify a QI plan. So how can Murray PHN support your practice with quality improvement? We provide licensing for PNCS Cat 4, access to PHN Exchange, support practice staff to use and understand Cat 4 and PHN Exchange, and review individual and collective data to identify areas of opportunity. Support to implement the model for improvement tools, as well as providing resources such as draft PDSAs, quality improvement templates, and videos. We offer education and networking opportunities, including an online forum, and we commission services. GP Hub on PHN Exchange is an online portal where an overview of your practice's de-identified data is available. This data is only visible by your clinic and a good place to start when looking for opportunities for improvements. Data is available on a broad range of topics, including PIP QI measures, data quality, chronic conditions management, and MBS utilisation. We can assist you in reviewing your data to identify opportunities for improvement. As you can see on the screen now, on GP Hub, we've expanded the PIP QI data measures, and this practice's HbA1cs for patients with diabetes is declining. As of September, 23% of patients with diabetes have their HbA1cs processed in the last 12 months. The PHN's average is also listed, and as you can see, this practice is below that. This potentially could be a good QI activity. We can assist you in planning, and we will now run through a demonstration of how to do this. So on the screen here, once the idea for improvement has been identified, a PDSA can be created using the model for improvement. So if you look at the screen here, this practice could potentially use the HbA1c recording for patients with diabetes, and they want to increase that to 70% or higher between 1st of August 2021 and October 31st, 2021. At Murray PHN, we recommend using the Model for Improvement framework for developing, testing and implementing changes leading to improvement. We're going to run through a demonstration of this now. As you can see here, this is a Word document and it's a draft templated model for improvement. So the goal for this clinic is listed up here in question 1. What are they trying to accomplish? They're trying to increase the HbA1c recording for patients with diabetes to 70%, which was actually the Murray PHN average or higher between this quarter, 1st of August 2021 and 31st of October 2021. Question 2 for the model for improvement is how we will know that a change is an improvement. So here you come up with your measure. So this practice, they could actually do this by monitoring PHN Exchange monthly to track their progress. And each month they could actually save a PDF of that data and save that as evidence within this activity. So question 3 under the model for improvement is what changes can we make that will lead to an improvement? So here you would brainstorm with your team around changes that you could run through to hopefully gain the improvement. So we've just here popped down 2 ideas. Idea 1 is to identify patients with a diagnosis of diabetes who have not had their HbA1c status recorded within the last 12 months and recall where appropriate. There's also a link here to a Cat 4 recipe, which will take you through step-by-step how to find those patients in Cat 4. Idea 2 here is to identify patients that have an indication of diabetes and not yet coded diagnosis of diabetes, and review and recall where appropriate. And here there's another link to a recipe showing exactly how to do this. Then you would work through each idea under the PDSA here. So for this demonstration, we're going to work with idea 1, which was to identify patients with a diagnosis of diabetes who have not had their HbA1c status recorded within the last 12 months and recall where appropriate. We're going to utilise Cat 4 clinical audit tool to do this, and we're just going to run through a demonstration of this now. On this slide here is just a diagram of basically the PNCS suite. So PAPCAT demonstrated there in the outer circle of this diagram is actually the software the PHN uses to aggregate all Murray PHN's practice de-identified data, and this is what is actually shown back to you in PHN Exchange. Now Cat 4, the clinical audit tool that we're going to go through today, is is actually used at the practice and is used to identify patient cohorts for quality improvement activities. And that's shown there in the blue circle of this diagram. Top bar works with your clinical software at the time of patient consultation and is shown in the middle of that diagram there. Now we're just going to go into the CAT4 demonstration and show you how to pull out the data for diabetic patients. So here on your screen is a demo version of CAT4 that you can access at your practice. All the data we're using here today is actually de-identified, but at your practice you'll be seeing real patients and be able to export that list and recall for their HbA1cs to be taken. So CAT4, the filter pane is up the top here, and you can filter by different patient demographics, and the below pane here is the report pane. So as we're doing this and you look at the general tab, you're just going to want to select active patients. So you're going to be wanting to focus this activity on patients that actually visit your clinic regularly and have been there 3 times in the past 2 years. Because we're looking at diabetic patients, you go to conditions and you want to select all of patients that have a coded condition of diabetes. Because we're looking at the HbA1c results for the last 12 months, you want to go to date range results and select within the last 12 months. You then recalculate this. After you've selected the criteria that you'd like to filter by, you click the recalculation button and that will filter out the reports down below. So you want to then go to pathology and you're looking at HbA1c results, and this here is showing you all the results within the last 12 months. So you want to select the no HbA1c results recorded. And if you export that list, it will bring up your patient cohort that you're looking at. So as you can see here, the patient cohorts have all been de-identified that I'm looking at, but you can then save this to an Excel document or whatever document format you would like to use your clinical software to recall these patients to get their HbA1cs done, or you can actually SMS recall directly from CAT4 if you have that set up. Then going back to our model for improvement here, once you've done all these steps that you planned out to do and you recall the patients and you look at billing the correct MBS items, you enter those results into your clinical software and you can record those results under do, study and act. So again, just to summarise how quality improvement will benefit your practice, so you can improve patient outcomes simply by participating in PIP QI, while working through the accreditation towards the accreditation standards. It doesn't have to be onerous and we can assist you with breaking the activities down and working with your practices to implement. So thank you so much for attending today. If you'd like a quality improvement consultant, please get in touch with us. We have 4 offices across our region. The numbers are listed there. And this GP support at murrayphn.org.au email is directly to our team. So if you'd like to email us, somebody will definitely be in touch to assist you with quality improvement. We will also be running further QI webinars, so keep your eyes out open for our upcoming webinars and our weekly updates, and always feel free to check our website as we're updating that regularly with quality improvement tools. Thanks again for attending and we can't wait to work with you all.